Stephen, it's not gone on to slideshow again. It's come off slideshow.
Hi, Pamela. If you press the button at the bottom, it should give you the full screen. You press on the bottom row of the PowerPoint, there is a slideshow button. Yes, that one, but click off the status bar. You click off that, and then try again.
What tries going to the...
And then press it's the bottom right-hand button. It's got a picture of like a projector. Oh, you've got this window up. Okay, try again, one last time.
What, down here?
Yeah.
Right, okay.
There you go. Right, ready?
Okay, right. Good morning, everyone. I'm pleased to talk to you today about the legacy of home working. Whilst this can be deemed a dry subject, I will try to make it as interesting as possible and give you some useful insights. First, a little bit about me. I've actually been in healthcare for around 35 years and have experience in most aspects of safety, health and well-being. I'm the CEO of Healthcare RM, and we provide an integrated approach to most aspects of employee health benefits. One of our key USPs is that of using a single system across all that we provide, and this has enabled us to capture and analyze data in a manner which is not normally available. This has led us to assessing the underlying causation and contributory risk factors associated with health, ill health, and well-being. Our data over the last 7 years has identified the vulnerabilities of our people from factors other than work-related risks, and this very much aligns with the factors identified during COVID. Whilst assessing and managing sickness absence, psychological needs, administering a healthcare plan, or conducting health surveillance, we consider the occupational, clinical, and personal risks. From this, we then develop care pathways that address not only the current symptoms, but consider the longer-term impact and quality of life and longevity. Over the next 25 minutes, I'd like to share some thoughts and learns that we have gained pre and during COVID so that we may consider how we can reduce the risks associated with home working for the benefits of our businesses and our people. I thought it was quite interesting that we should actually start with a definition. And actually, when I started looking at this, my first search was on Bing. And I was quite surprised to actually find that the definition was the ability to perform your work from home, especially when doing low-paid work or when you normally travel to work. That reference to low-paid work is something that many of you will probably not remember when women and men were actually working at home doing piecework, often for pin money. And I think it's quite an out-of-date sort of definition. So for the purpose of today, I'm going to use the Corona definition, which is the use of the home supported by technology for the remote performance of some or all of an employee's normal work. I've also added in a note on flexible working, as this often gets confused with home working. And so for this, the definition is the ability to perform your work from anywhere and where your hours can be flexed to suit. So for some organizations, this may or may not include home working. So let's look at some of the headlines if we go back a few years, say in the last sort of 10 years. And some of the IT tech companies actually adopted home working very, very early on. And yet in 2013, we see that Yahoo does a U-turn on home working because speed and quality is sacrificed and highlights the business benefits of being together. Interestingly, a few months later, Hewlett-Packard actually did exactly the same and said, all hands need to be on deck. And yet by 2016, the Financial Times were actually saying the office is dead. People are shunning the commute and escaping to the country. But then in 2017, we actually start getting some research coming out that say that work intensification leads to the ability to switch off. some comments that I will share with you on the next slide. So let's look at a summary of some of the opinions then pre-COVID. Well, we've actually 10, 20 years ago, we heard that it was traditionally only for senior management and traditionally associated to be with low paid workers, the opposite end of that. But more recently, we've actually thought about it provides a better work-life balance, enables a person to be more active, enables them to spend more time with their family, improves efficiency because they're not traveling and they're not having unnecessary meetings, reduces stress and is a lower cost to the business as there is need for fewer offices, and it's better for the environment due to less travel. So if we now look at what we have learned during COVID, where most of us have actually had real life experience of what home working is actually like, then what have we thought about it? Well, a number of us actually moved to home working because the government said we must. The Institute of Economic sort of Studies actually found that 71% of people were working from home during the pandemic. I'm not sure how many people they actually surveyed for that, by the way. We thought it won't last long. Very few of us saw the need to assess physical and psychological risks. Very few of us understood the extent of cyber risks. Some businesses decided to sell offices or not expand their offices. Few monitored sickness absence or presenteeism, and few monitored the impact on performance and efficiency. So what have we actually learned? Well, for most of us, work and life has morphed into one. So it's not exactly the work-life balance that we thought, and very little differentiation between home and work. Work extended after hours for many of us. People were actually claiming that during the day on Teams and Zoom calls, and then at night had to catch up with their admin. The initial novelty of physical activity and increases in physical activity seemed to wear off after the first few months. And people complained about that their quality of time with their children was reduced. So one of my own colleagues actually sort of said he'd sit down at night on the settee with his son, but then whilst he was playing with his son, he was also looking at his emails. So let's look at some other articles that appeared during 2020. So a Fortune article actually said it poses serious dangers for employers and employees, and talked about the fear of slacking, the fact that people were working at night, and I've certainly received emails in the early hours of the morning, the lack of boundaries between home and work, and some employees are actually close to burnout, and those that are 2.6 times are more likely to seek another job, and 63% are more likely to take a sick day. The Guardian actually sort of said we're sleepwalking into a drastic societal change, and that research may suggest that people like home working, but this oversimplifies the case. So I've got a few poll questions, and what I would like to do is to ask you as the audience, have you undertaken robust risk assessments of the physical environmental risks of working from home? So if you could vote now, please, and I hope to get the results in a second. Oh, I've got a note that the panelists can't vote. Stephen, it's frozen. So the results of the vote are in, is we've got 50% of the audience have actually polled that yes, they have done assessments, so that's really good. 42% have said no, and then I think it's, can't read it, a few percent have actually said they don't actually know. So hopefully this will work to go on to the next slide. So Stephen, it's still just not moving.
If you try and click back onto your PowerPoint.
I'm actually on the PowerPoint. Oh, right, we're there. The wonders of technology. So, okay, let's take that into account. So if we look at the physical issues of home working, then the workspace at people's homes may or may not be a dedicated office. I mean, people, as you know, are using their kitchen tables, their dining room tables, their bedroom tables, and a whole host of other things, sometimes coffee tables. Now, obviously, as an audience, you've come out really well, as 50% actually looking at assessing the risk. The Institute of Economic Studies actually found from the population they surveyed that 75% had not assessed the risk. And if we don't assess the risk, then we're looking at future musculoskeletal problems. The IAS also actually found that 60% of people that they surveyed were actually worried about taking less exercise. And this is very consistent with our data as well, because there's less physical space to walk around at home. It's not very far from, in most people's houses anyway, from the kitchen to the sort of bedroom to the lounge. They also found reductions in strength and conditioning, leading to a decline in the musculoskeletal system, and saw an increase in back problems by 55%, neck problems by 58%, and shoulder problems by 56%. In addition, distractions such as children, partners, neighbours, friends, TV, radio, and access to that wonderful fridge could also lead to other physical problems. This is a sort of image of something that I've used for many, many years, and it dates back to 1974, but it's as relevant today as it was in the 70s, in fact, more so. And as you'll see from the three images, the middle image is actually representing the head actually moving 2 inches further forward and increasing the sort of load. So what we're actually looking at is a forward head carriage of literally just 1 inch can actually cause an 8% of total body weight on the neck muscles and stretching the ligaments. Every inch the head moves forward, the load gains increases. So you'll see from what is on the slide, the 1 inch is 8%, the 2 inches is 16%, and then the 3 inches is in 24%. I'd like you to think about where are you on this sort of diagram, because certainly I've seen since returning to the office, and as more and more colleagues are coming back to the office, I've actually noticed that even some of our younger people, their heads are moving forward and certainly have moved 1 inch to 2 inches. In fact, one of my colleagues, when he first saw this slide, actually said that he'd been suffering with severe headaches. But when he started adjusting his posture, guess what? The headaches disappeared. What is also interesting about this is that when the muscles contract dysfunctionally like this, then it can actually cause a problem with blood flow to the brain. Now, if you can actually see on the slide, it says a 5% reduction will cause 50 to 70% loss of blood flow. But so imagine if you're that sort of 2 inches or even 3 inches, but certainly 2 inches, how much the lower blood loss you're actually going to get to the brain. And this can actually cause problems with productivity in the workplace. And because of this and the nutrients to the brain, can have great impact on headaches and migraines, but also, as we've actually seen, on neck, shoulder, and even lower back problems. So the next poll question that I'd like you to actually look at is, have you assessed the psychological risks of working from home? If you can please vote now. Just waiting for the results. Anytime now, we will get the results. So again, we've got a really good audience in the fact that 43% of you have actually assessed the psychological risks, 50% have not, and 7% of you sort of don't know. So that's actually a very good outcome, because an awful lot of organisations do not assess psychological risks. So we've obviously got a very good audience in terms of, and probably because of your professions. We seem to have an issue with the transit. Oh, yeah, it's moved again. So looking at the psychological issues, so what are the issues that we've identified during COVID? Well, isolation is a big problem, and we know that the Health and Safety Executive, ROSPA, are all talking about lone working, but it's very easy for us to become withdrawn from social contact. The Financial Services Union, and I've tried to scatter some of these things across the world, is that they've actually found that 56% feel an increase in work intensity and 44% feel more pressure. Now, remember, this can actually be a perceived risk rather than an actual risk, but perceived is reality in lots of people when it comes to psychological issues. Also, 66% reported an increase in work-related stress. Now, given the fact that we thought that home working was going to be less stressful and give us more home-life balance, then some of the studies are actually coming out and saying that that's not exactly the case. Also, the fact that things are less spontaneous, everything needs to be planned. And oddly, a lot of people are reporting they're not as effective as those chats by the desk, even some of the corridor chats and the other things that we actually might do when we're socializing in the office. Frustrations of systems, speed of Wi-Fi connection, telephone networks, lack of 2 screens, lack of a lot of normal office equipment can actually also cause to a lot of stress. And there's still people, and I think we need to be mindful of this, that will be fear avoidant of returning to work and previous activities. And how about well-being? Well, certainly, and I'll share you some of our data in a moment, are people now taking less exercise than before? And that is certainly something we're experiencing. Are employees eating more and making the wrong choices? Are we going to see more longer-term health problems because of the NHS and the waiting lists? Are the psychological stresses of COVID going to continue for some long time? And particularly, we've got the impact of long COVID emerging, which can lead to not only physical and psychological issues. But how can we encourage employees to make sustained behavioural change? This is one of the problems that we face from a public health point of view, as well as a corporate health point of view, is how we actually get people to take control of their own health and make those changes. And I think financial issues were a problem before COVID, but now there's extra increases on families due to redundancies, food prices seems to have escalated, and economic uncertainty. So just sharing with you some of the data that we've actually pulled over the sort of COVID 15 months. This was based on 8,771 cases that actually came in. And what we actually saw in the sickness absence cases is that in 2019, inactivity was showing in these cases, so these people that were ill, 83% were inactive. That grew to 92% in 2020, and what we're seeing so far in 2021 is 96% of the people that are ill are actually inactive. We've also seen an increase in weight from 64% to 70%, and this is based on subjective reporting. So if we put them all on scales, we might actually find that it's greater again. Personal stresses don't seem to have changed a great deal in this sort of period, but family ill health is still a major problem, as with relationships. And I think understandably during COVID, those are two that have remained under pressure. As you would expect, we've seen a noticeable shift with childcare stresses increasing to 55% from 55% from 2019. Interestingly, though, in short-term sickness absence, we've had between 2019 and 2020, for mental ill health and musculoskeletal, we actually saw a reduction in absence of 37% and 47% respectively, due to, we believe, underreporting of absence when home working. But if you look overall, comparing 2019 to 2021, those presenting with stress has increased by 56%. And we've seen an overall increase in mental ill health, particularly in anxiety and depression during COVID. Also in the data, we've seen a significant increase with lower back related problems, lower backs reporting 6 times greater than before, and those with upper back and necks 3 times greater. So consistent to some of the other data that I shared with you earlier. So how about impact on productivity? Well, everything takes a lot longer to do, as I've mentioned. There's less supervision and management, and supervisors and managers can get quite frustrated about how difficult it is now to manage their people. And conversely, employees can actually feel more unsupported because of that lack of supervision and management. Communication needs are greater, and I mean, we need to think about that really carefully. Sickness is often more difficult to identify the short-term absence, but also presenteeism, because we don't know, what people are actually doing from home. Inconsistency with connectivity can impact on productivity. A lot of the equipment, as I've mentioned earlier, can be less supportive to a productive environment. There's also an increased risk of GDPR breaches, simple, silly mistakes that can occur during this time. So my final poll question, and given the I'm not quite sure of the different professions that we have in the audience, I assume that a number of you from a health and safety point of view may not know the answer to this question, but you might if you are from a risk management point of view. This might be part of your role. But are you aware of the information security risks of working from home and the impact it can have on your business and your people? Please vote now. Any minute now, we will get the answer. So 82% of you have actually said that you are aware of the information security risks. 14% have said no, and 4% have said don't know. So again, an astounding result on that, because an awful lot of people that in businesses that we deal with literally don't understand the extent of the security risks and the impact that can have on their business and their people. Just waiting for the slide to catch up and change. Stephen, it's still just not moving.
Hi, if you just try clicking on your presentation again.
Yep, worked. Thank you. Yes, I'm obviously not sort of technically astute. So looking at the information security risks identified and that was actually published, various articles again across the world without the press, is without an office, the sorts of things that is actually there is phishing and ransomware can more easily evade corporate defences. Access to experts is more difficult and staff may fail to report issues. So the three realities of cybersecurity is growth and virtualization of the workforce and precipitating events for much cyber risks. So cyber risk is not a problem with a defined endpoint, and humans, employees, are the weakest link in any organization's security. So cybersecurity training is no longer a nice to have, it's very much a sort of need to have. So taking all of that, let's look at what do we need to do better in the future. Well, from a short-term sickness absence, things seem to have been reduced, but are employees working when ill? For example, colds and tummy bugs. But is this a good thing, or is it hiding a future problem? And for example, given the underreporting and absence that I shared earlier, if somebody's stressed, anxious, or depressed, but they're actually still trying to work because they feel under pressure to do so, then is this potentially going to cause us a long-term problem? So is it negative that they might still be working, when they're at home, when actually they should be resting? what better preventative measures can we actually sort of take to actually look at things in the future? For example, DNA and epigenetics, where we can actually look at genetic risk factors and what we can actually do to actually reduce the potential risk to individuals, particularly in the future. And this is something that we're looking at from a public health perspective as well, both in terms of longevity and the quality of life. Are some employees being opportunistic? And certainly other employees are very, very upset. It affects them psychologically if they think some people are just taking advantage. And do we need to provide more support for long-term conditions due to NHS waiting lists? Private medical insurance hasn't really sort of developed over many, many years now. Medical trusts can actually be a way of you designing your own benefits and rules about what you want to provide. But it might be that we have to start looking at ways in which we actually support our people with things like long COVID, but also conditions that they can't get treated under the NHS, which we haven't had to do for many, many years because the NHS has been providing such an excellent service. So the challenges that we face, the right from home legislation was rejected by the government, but I think they're still looking at things going forward. But we're still going to be faced with employees that want to work from home full time, and how are we actually going to address that? We have to sort of think, when we say that we're actually giving people choice, is this really what we're doing, or are we saving money? And will this have a future impact? Are there any unintended consequences of our actions in terms of social isolation, reduced productivity, and more cyber attacks? Are we going to be reliant on more communication by devices rather than in person? And what is the upside and downside of this? Are we assessing the physical and psychological risks and who can be harmed, and how? Well, a number of you have said you actually are, which is great. Are we really helping our people? But are we actually measuring that, and how often do we need to sort of review that? So recommendations from an information security, which given your voting suggests that you're probably all ahead of this, but I mean, certainly a lot of people see it as a game changer and are saying that we've got to be more diligent. Personal devices, and a lot of people are using their own personal devices, lack robust security, and data leaks mustn't be prevented. Home IT equipment needs to be of the same quality and security and maintained to this standard. And I'd love to know how many of you are actually been able to do that. Confidentiality, we never quite know who can actually access the data in somebody's home, but it will also depend on what sort of level of data you're processing and controlling. And if you're using sensitive personal data, special category data, then it's obviously more important that you actually ensure that that is secure. Broad connectivity may be poor and fiber may be faster, but both can be compromised as a shared resource. Corporate infrastructure should be configured for multi-factor authentication. I guess a number of you are actually sort of doing that. You need to ensure that personal devices, if you're using them, have the latest patches and security updates. Ensure regular external and internal pen testing. Use the latest technology. I mean, we use people like Darktrace and Egress, and we're just amazed how much they actually sort of catch and what they find. Keep up to date on phishing, whaling, security training and awareness for all employees. Make sure employees are comfortable reporting mistakes if they suspect something's wrong immediately. Ensure in the UK they're at least ISO 27001 and 27002 accredited, and where possible use a UCAS accredited auditor. Also considering using software to support compliance and update on the scope of accreditations, as you know, it can be quite complex to keep on update all of this. So in summary, conduct robust risk assessments of all of the issues associated with home working, which it sounds as though a number of you are actually sort of doing. Consider cybercrime as a critical factor to protect business and personal data. And as I've mentioned, the level of risk will depend on what sort of data you're actually using. The psychological risks, well, it sounds as though a number of you are mindful of these things, but we need to look at who is suitable home working and who is not. We need to consider the environmental risks, so at the place where people actually work, to limit distractions, noise, heat, cold, and the additional security risks. We need to consider the physical risks and the specific office space in the home and the correct equipment and the working environment. We also need to think the long game and think the unthinkable about what could happen. assess the effect on productivity and quality, and only consider home working or flexible working where we can manage the risks for the business and your people. Thank you very much for listening.